A 70-year-old man arrives at the emergency department with worsening shortness of breath over the past 3 days. He says he can no longer lie flat at night and has been sleeping propped up on 3 pillows. Last night, he woke up suddenly gasping for air. He also reports swelling in his legs and rapid weight gain over the past week. He has a known history of chronic heart failure due to ischemic cardiomyopathy and admits that he missed several doses of his medications recently and has been eating salty foods. On arrival, he looks distressed and is breathing rapidly. His blood pressure is 160/95, heart rate 118, respiratory rate 28, and oxygen saturation is 88% on room air. On examination, there are crackles heard throughout both lung fields. His jugular veins are visibly distended, and there is pitting edema in both lower limbs. His heart sounds reveal a third heart sound, or S3 gallop, indicating volume overload. Laboratory tests show elevated BNP levels, suggesting cardiac stretch and fluid overload. A chest X-ray reveals cardiomegaly, pulmonary congestion, and bilateral interstitial edema. These findings confirm acute decompensated heart failure, a sudden worsening of chronic heart failure symptoms. Acute decompensation occurs when the failing heart cannot meet the body's demands, leading to fluid buildup in the lungs and peripheral tissues. Common triggers include medication, noncompliance, excess salt intake, myocardial ischemia, arrhythmias, infection, and uncontrolled hypertension. Immediate management focuses on stabilizing the patient and relieving congestion. He is started on supplemental oxygen and placed in an upright position. Intravenous loop diuretics, such as furosemide, are given to remove excess fluid. Because his blood pressure is elevated, vasodilators may be added to reduce cardiac workload. Continuous monitoring is essential to assess urine output, renal function, and electrolytes. Over the next several hours, his breathing improves as diuresis begins and pulmonary congestion decreases. Once stabilized, his long-term heart failure regimen is reviewed and optimized to prevent future episodes. Key takeaway: sudden worsening dyspnea, orthopnea, pulmonary crackles, elevated JVP, edema, and high BNP are classic features of acute decompensated heart failure. Rapid recognition and prompt diuresis are critical to relieve symptoms and prevent respiratory failure.